And welcome back. The questions still coming in about COVID-19. We're continuing our live virtual conversation with state epidemiologist Dr. Benjamin Chan. Peter asks, if recovered from COVID, can you skip wearing a mask in crowded indoor social settings and not risk infecting others or risk being reinfected yourself? If yes, how long does this last?
Yeah, this is another great question. And unfortunately, things are rapidly changing with the emergence of the Omicron variant. And so people that were previously infected with another strain of the virus, we believe are still susceptible to getting infected with the new Omicron variant. And so even people with a prior infection, even people who have in the past gotten, fully vaccinated, so we're still recommending that people take precautions when they're indoors around other people, particularly in public settings. And so it remains important still for people that have been previously infected, for people that have even previously been vaccinated, to continue to wear face masks in indoor locations, to practice physical distancing, to avoid high risk settings, to stay home when they're sick or having symptoms of COVID-19 and seek out a test. We're still recommending a multi-layered prevention approach to COVID-19, particularly as we see such high levels of COVID in our community and this new variant emerging, which we know can evade a person's immune system.
Denise asks, the updated CDC isolation and quarantine guidelines are somewhat long and drawn out and very confusing for some and misinterpreted by others. Also, the guidance is different based on which vaccine you received. Do you think the CDC should revisit and streamline the guidance?
Yeah, so thank you, Denise. I will also acknowledge that the guidance has been very confusing for many people. And part of the reason for this is that it's not a simple time frame anymore that people need to isolate or quarantine after an exposure or after an infection. It's really a package of interventions that somebody needs to implement in order to shorten the duration of quarantine after an exposure or shorten the duration of isolation if they're infected. And that's confusing. That's difficult for many people to implement. I am not aware the CDC is planning on changing their guidance. And certainly we have waited for some of the details of that guidance before adapting to New Hampshire with some modifications, but we'll continue to work at trying to address some of the confusion that's out there to try and make it more clear. There are more resources coming from CDC, we've heard. We're trying to put out more clarifications to the guidance as we hear about the concerns and the confusion, but I don't believe changing the guidance is on the table at this point in time.
Tammy asks, why are we not using proven effective medicines like ivermectin? Tammy went on to cite a study from the American Journal of Therapeutics about this drug ivermectin. Is that how they say it, doctor?
Yeah, so ivermectin is an older drug that has typically been used to treat parasitic infections, typically parasitic worm infections. And so this is an older drug that has been and continues to be studied to see if it's effective at treating COVID-19. Certainly there is some data to support possible effectiveness of ivermectin at treating COVID-19, but there's other studies that really conflict with that and show that it may not be effective, or it requires very, very high doses in order to have higher levels of effectiveness. So it's certainly at this point not a proven treatment. And when it comes to medical treatment for COVID-19, we really look to some of our national science and medical professional agencies like the NIH and the Infectious Disease Society of America to help assess all of the studies that are out there. And right now, ivermectin is not recommended by the NIH. It's not recommended by the Infectious Disease Society of America because of unproven benefit. That's not to say there aren't studies out there which show that it could be beneficial. It just means that there needs to be more study on this medication. And for right now, it's not a medication or a therapeutics that is being recommended by the national professional medical societies.
Maureen asks, how soon can you get your booster after having COVID?
So somebody needs to be off isolation before they can go in and get a vaccine if they're eligible and recommended to get a vaccine. We're saying that anytime after about 10 days after an infection, if somebody is eligible and recommended to get a booster shot in this case, then they can go in and get a booster shot. There's not a need to wait, but we do require people to not be infectious and potentially spreading COVID-19 any longer when they walk into a medical setting to get a vaccine.
Good questions and good answers, Doc. We'll have more questions for you coming up right after the break.